All righty. Hello, hello, hello. Happy Wednesday to everybody. Happy hump day. Hope you guys are doing well. Hope you're feeling well. Welcome, welcome. We have some folks trickling in. My name is Trinice Goodlow, also known as Dr. G the NP. Super pumped to do this session with you guys. Welcome. I want everybody to get settled in. I will ask you guys for a small favor before we get started. If you can see my screen and hear my voice, please give me a 5 in the chat. Want to make sure we're not having any technical difficulties, making sure you can see and hear me because, well, if you can't hear me, you can't see me, then I guess why are we here, right? So, like I said, guys, do me a solid and throw me a 5 in the chat if you can see my screen and hear my voice. Awesome, awesome, awesome. Okay, so I appreciate you guys. We'll go ahead and get started. And so, welcome to From Frozen to Fearless, why you struggle with 12 lead EKGs and what to do about it. Okay. Because unfortunately, the reality of the situation is you are one step away from the worst day of your career by not being able to read an EKG strip. So awesome, awesome, awesome. There we go. We got people trickling in. What's up, Rhonda? What's up, Dina? What's up? What's going on? What's going on, Stacy? What's going on, Lee? There's a trickling in. Okay, awesome, awesome. What's up, Beth? Shout out to you, Beth. Welcome, welcome, welcome. Okay, I was feeling a little lonely, but now I feel accompanied. So thank you all very much for the 5s and the welcomes and whatnot. So we'll go ahead and get started. Okay, so like I say, guys, welcome. I want to start with something in our field that no one really says out loud, right? So every single shift in ICUs, on telemetry floors, in emergency departments across the country, nurses are handed EKG strips, asked to make a call, okay? And a significant number of them, quite truthfully, are just guessing, right? Let's just be real, okay? Not because they're bad nurses or not because they don't care. It's because no one ever gave them a system that actually worked, okay? And here's what is very terrifying, right? The patient doesn't know you're guessing, right? The EKG doesn't wait for you to figure it out, right? And most importantly, the outcome doesn't change because you meant well, right? Because we all have pure intentions. That's why we got into this field. So there's going to be no fluff. We're going to talk about what's actually happening, why it's happening, and what we're actually going to do about it, okay? So let me tell you about a scenario that happens, let's say, more than anybody cares to admit, if we're going to be truthful here, okay? Patient comes in, okay? Vague, non-specific symptoms. Oh, I'm fatigued, right? We're all fatigued, right? They might have a little bit of shortness of breath, but they can't really describe it that well to you. EKG prints out. The computer says normal sinus rhythm, right? The nurse looks at the EKG, nurse practitioner looks at the EKG. Something feels slightly off, but she's not really sure, right? I mean, the computer did say normal, and she doesn't want to look like she's overreacting, so just kind of moves on, right? 2 hours later, that patient is in the cath lab with a STEMI that was right there on the strip, okay? So I'm not telling this to scare you. I'm telling this to you because it's real, it's documented, and there are a number of attention and attachment that could stop every nurse in this room cold, right? Like that's enough. If it said normal and then boom, you knew 2 hours later your patient had a STEMI there in the cath lab. That's like you're gonna have a heart attack at that point, right? So check this out. The computer is wrong up to 42% of the time, okay? Particularly in things that kill people, such as myocardial infarctions, such as atrial fibrillation, okay? I'm gonna say that part again. Nearly half of the time when it matters the most, the machine is telling you everything is fine, okay? And you may be the last set of eyes before that strip actually becomes a decision, all right? Not the attending, not the cardiologist, you, because we know a lot of times we are the last set of eyes for that patient, okay? So when you don't fully trust what you're seeing, when you hesitate and defer to the computer or quietly hope that someone else catches it, that's that gap between what you know and what you need to know isn't just uncomfortable, it's actually dangerous, right? It's literally life threatening for that patient, okay? So here's the data about when we talk about EKG competency within nursing. So there was a 2023 study that tested ICU nurses, not med-surg nurses, ICU nurses, very high acuity, very capable nurses on 12 lead EKG interpretation. Less than 1% got every question correct. Got to say that one again. Less than 1%. which means almost everyone in that study, including the nurses with years of experience, nurses who work critical care every single day, were operating with a gap in this skill. And the system isn't protecting you from that gap. It's counting on you to close it yourself. Problem is, most nurses never do. Not because they don't want to, but because the way EKGs are taught. Let's be real, it's fragmented, it's jargon heavy, it's memorization based. It doesn't build real confidence. It builds the appearance of knowledge right up until that moment it's tested in real life, right? And that's when you freeze, right? And you guys know the freeze. I know the freeze, right? EKGs in your hand, the room is moving, your brain is doing that thing where instead of reading what's actually there, it starts cycling through everything that might be missing. And that freeze costs time, right? And in the wrong situation, time is everything. So here's the thing you need to hear. And I mean, really hear this, okay? This is not your fault, but it is your problem. The anxiety you feel around EKGs, the second guessing, the quiet dread when a strip gets handed to you, that's not a sign that you're not smart enough or you're not cut out for this. Like, it's actually quite the opposite. It's a sign that you're expected to master a skill, but you were never given a system. Okay. So think about what you were actually taught, right? Like, think about it. Maybe a lecture, textbook chapter here or there, handful of practice strips. Someone probably got up on the whiteboard and said a couple of this is this rhythm and this is this abnormality, right? And you were told to look for patterns. Then you were expected to apply that under pressure in real time with a real patient on the other end. Guys, that is not training. That's just exposure, right? You were exposed to that. And when exposure fails you in high stakes moment, right, exactly, Rhonda. Exactly. That's not training. They're just showing you something, right? So because that's what exposure does, you don't think, oh, I need a better system. You think, oh, I'm not good at this. No, 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 no. The system has failed you. Okay. Then you start avoiding it. You lean on the computer. You wait on a colleague to confirm what you're seeing. You get quieter in moments when you're meant to speak up. And the longer that goes on, the wider the gap gets. So I'm not here to make you feel better about that gap. I'm here to show you how to close that gap. Okay. So I am a cardiology nurse practitioner and I've trained thousands of nurses and NPs to read EKGs with real clinical confidence. But before that, I was exactly, when I say exactly, I was exactly where you were. I remember standing at the nurse's station, EKG in hand, thinking, man, I went to school for this, but why does it just feel like I'm guessing, right? Like the information wasn't the problem. I had plenty of information. What I didn't have was a way to move through an EKG, a repeatable step-by-step approach that my brain could follow even when I was under pressure. So once I built that system and started teaching it, something happened that I really didn't expect. Nurses who struggled with EKGs for years were getting it within hours. So because for the first time they had a process, not just facts. And that's what I want to start showing you tonight is a whole process, a practice changing process. Okay. Now, before you can interpret anything on an EKG, you need to know where to look first. And I have had varying people tell me varying things through the years about where to look, okay? Because most nurses start wherever their eyes land, right? You may scan, you may react, you might have a physical reaction. Because there's no starting point. When there's no starting point, there is no confidence, right? It's just kind of noise. So I want you to check out my firework analogy. I'm gonna see if you guys like this, my firework analogy. So I want you to imagine that it is the 4th of July, best fireworks show in the city, and I give you 3 options of where to sit to enjoy this fireworks show. Option 1 is gonna be on the ground. You get your lawn chair, get your cooler, get your little blanket, get a little snack, and you just lay out enjoying the beautiful night sky, okay? That's option 1. Option 2, you see our center option there in the middle, is a tower. It's about 300 feet in the air. It's literally in the center of the fireworks venue. You're so close you can feel the booms. You feel it through your body, right? So everyone's standing out on the lovely balcony enjoying the fireworks show. So that is option 2, that you sit in the tower, okay? Last option is option 3 is the helicopter. So we rent a helicopter, very expensive, right? Very expensive, but we will allow it, right? We will allow it. So Very expensive. We have you in the helicopter, and you're actually hovering over the fireworks show, and you're able to enjoy the show down below. So, my question is, which one gives you the best view? Y'all let me know. The chat is open. The chat is open. I want to know, where would you sit? Which vantage point is going to give you the best overall view to enjoy this fireworks show? Option one, on the ground. Option two, in the tower. Or option three, in the helicopter. Give y'all a little second. Give you a little second before I spill the beans here. Okay. Okay, Ron. Okay, Dina. Okay. Okay, Lee. Okay, Lee. We got some answers coming in. Okay, Stacy. Okay, okay. It's kind of a consensus in this group. Everybody is giving me option one, in the ground. Okay. And I will say, most times when I do this lecture, most people actually tell me option three, in the helicopter. I mean, there's a lot of bougie people out there. They like being expensive, right? But I would agree with you guys. Option one is the answer. And let's kind of explain that why. Okay. Option one, I get to see the whole fireworks show in front of me, right? And so I'm not too close, I'm not too far, I'm just at the right angle. I get the full picture, I get everything, okay? So the lead in an EKG that gives you the best overall view of the fireworks show is option one, on the ground. It's lead two. Lead two is an inferior lead at the bottom. And so when you're on the ground, you are inferior. You are bottom and everything is above you. So I want you to remember, you're not going to look at the rate. You're not going to look at the numbers. You're not going to look at the squiggles. You're going to go straight down to lead two. Oh, that reminds me. And as far as the fireworks show or fireworks is concerned, the fireworks show that I want to see is SA node, AV junction, right bundle, left bundle. SA node, AV junction, right bundle, left bundle. That is the fireworks show that I want to see, and that will give me the best overall view if I go straight down to lead two. Okay, so from here on out, you're not going to get flustered. You're not going to get angry. Most people don't get angry. Confused, avoidant, anxious, all those sort of emotions. You're going to go straight down to lead two. Okay, straight down to lead two. So the P wave, the QRS, the T wave, everything shows up cleanly in lead two in a way that no other lead can give you reliably, right? So we're always going to start there, not because of habit, because of a strategic vantage point, okay? So lead two is going to be your best vantage point, okay? So moving forward, now once we're in lead two, I mean, what are we doing, right? What kind of system are we putting together here, okay? Because the issue is, when people are in lead two, most people think the first step is diagnosing. Like they go, okay, I got to find the problem. Like, does he have any PVCs? Does he have any ectopy? Does he have a block? Does he, right? They're hunting for problems and trying to name things. That's like trying to bake cookies by starting the oven at room temperature. Okay. It's not going to work. You're skipping steps. Okay. So what do I mean by that? Let's say it's Christmas Eve and you're baking. You pull out flour, you got the butter, and all of a sudden, you're mixing, you're moving, and got a little Christmas music on because, you're doing your thing, right? And all of a sudden you realize, well, crap, I'm out of sugar. You in the middle of baking, and now you got to go to the store. You got to go on a long line because it's Christmas Eve. And by the time you come back with the sugar in hand, that batter is bad and the dough falls apart and you're frustrated and you have to start all over again. And that's what reading an EKG looks like without starting a system. You react, you jump, you lose your place. And in the clinical world, starting all over means time that a patient may not necessarily have. So what is the right move to do in this situation? Well, if we were baking, the right move would be is to get you a nice little sheet of paper, a little pad here, and write down your ingredient list before you start baking. Because if I write down my ingredients and I'm missing something, I can gather all of those together and then start my baking process. Versus if I start baking and I'm missing something, I got to go to the store and I start again and, oh, I forgot that. You're running back and forth to the store. So we want to be very organized, okay? Now, as far as the EKG, a 12-lead EKG is concerned, before you do anything, you're going to check those ingredients as well. So in lead two, you're going to ask yourself 3 questions. All right, you're asking yourself 3 questions in lead two. Do I see P waves? Do I see QRS complexes? Do I see T waves? That's it. Those are the three questions you're going to ask, okay? I want to be perfectly clear. I didn't ask you to measure it. I didn't ask you to count anything. Didn't ask you to diagnose. I'm not asking you to jump ahead. I'm simply asking you, are all the ingredients there? Those questions are answerable in under 10 seconds. You could literally pull an EKG now, go to lead two, and answer those three questions all within 10 seconds. I would argue within 5 seconds. Boom, boom, boom. Very quick. Okay. So this changes everything about how the rest of the EKG is interpreted. Okay. Because once you know what's there and what isn't there, now you have a starting point. Now you're ready to interpret the EKG. Because before you weren't, you didn't know where to look. Lead two now. When to look, well, step one, what to look for. Looking for a P wave, looking for a QRS complex, looking for a T wave. So that's what happens when you have a system, because you know where to look, when to look, and what to look for. Okay. So I know what some of you guys are thinking now. Some of you guys are like, Trinice, girl, that is just too simple to matter. Like, I sort of knew it, but I sort of didn't know it, but that just seems too simple because EKGs are complicated. But that's the thing that most nurses never do. They skip the foundation because it feels too basic. And then they start trying to jump ahead into interpretation. And then when the interpretation doesn't work because they never checked the foundation was solid in the first place. Okay. So here's what I want you to understand. The nurses who read EKGs confidently are not smarter than you. Okay. They don't even have better instincts. They just simply have a process. It's really that simple. They have a process. So when you have a reliable starting point, something shifts. Your brain stops spinning out. You stop imagining everything that you might be messing up, or you start seeing things that aren't actually there. I know I was the queen of that. So, and that's not a small thing. That's the difference between the nurse who freezes and the nurse who leads. Okay. So we covered one step. Okay. That was my first step in my systematic approach. It's a 9-step process. That's step one. Okay. And I want you to notice right now whether something feels even slightly different about how you're thinking about an EKG compared to 5 minutes ago before we went over those two analogies. Okay. Because if it does, here's what I need you to sit with. Okay. That feeling is what a system does. It does not teach just what to see, it changes how your brain moves through what you're seeing. But the truth is, what we've covered here this afternoon, or this evening rather, that's really just first step of 9, like I had mentioned before. And while the first step matters enormously, the real clinical situations you're facing, that subtle STEMI, the blocks, the AFib that looks almost normal, the one that the computer called fine, those, requires a full system. Okay. So right now, you've been at a starting point, but without the rest of the system, you're still standing in the doorway. You're still in a situation where the machine is wrong nearly half of the time, and you're not yet at the place where you can confidently catch what it misses. The gap is still there, and every shift you work inside a gap, that's a shift where you're relying on luck. You're relying on the computer. You're relying on someone else's opinion or someone else's experience, right? So what I'm about to show you is a program that I have specifically chose to close that gap systematically in a way that actually sticks. It's called the EKG 100 experience, and it's built around one single outcome, you leaving with a system that works under pressure every single time. So here's what makes this different than anything you've had before. Because again, you've had the exposure. I'm not about exposure. I'm about outcomes. You're going to spend over 3 hours with me personally. Okay. You're going to read EKGs in real time. Most courses don't do that. It's a multiple choice, or you kind of, is that a PVC? Is that a PAC? Whatever. We're not doing that here. You're going to be making the EKG call in real time. Okay. Then we're going to walk through it together step by step with clinical reasoning that is visible the entire time. I want to hold your hand and I want to walk through it with you, because that's where the shift happens. Not in notes, not in a review. It's in a moment where you get to make the call. And if it's right, that's going to build your confidence and you're going to know why it's right. This is built on stories. This is built on analogies. This is built on a framework that sticks. You're going to remember fireworks before you remember any kind of textbook. Okay. That's not a flaw. That's just the way the human brain works and thinks under pressure. So more about the EKG 100 experience. In week one, we're going to rewire how you approach an EKG. That is where I'm introducing my full 9-step systematic approach and walk through the single biggest mistake that clinicians make even before they read the strip. Okay, I'm covering that in week one. This week is going to change how your brain approaches every EKG from that point moving forward. When we enter week two, we're going to build that foundation that makes everything durable. And with my course called The Anatomy of the EKG, you're going to get that content within this entire experience. CEUs are included. You get lifetime access to this. You're going to understand what you're looking at structurally. I don't believe in pattern matching. This is what makes the system actually last. Not to mention in that course, I have 8 analogies, 8 different cartoons. So it's going to be fun and memorable to you. Now, week 3, we're going to meet live again. That session is going to be an hour and a half, and we're going to build real confidence through real strips. Again, this is live EKG practice. I'm putting the EKG up on the screen, give you a chance to interpret it, then we're walking through it, okay? In real time. You can use the 9-step system out loud. Confidence does not come from studying, it comes by doing. I'm a firm believer in that, and I want doing in my program. Now, week 4, this is a stress test of the system, if you will. So I'm going to introduce some more things. I'm going to talk about different types of sinus rhythms. We're going to talk about different conduction blocks and even normal variants. That's a video course that you get, EKG 100. Again, it includes CEUs and it includes lifetime access to you. And this is where the range gets built. This is where the practice, this is where the confidence drops because your scope is going to expand and the system gets tested against the rhythms that, oh yeah, fool people. They fooled me when I was new. I was ordering stress tests left and right on normal EKGs and I didn't even know it. Week 5, we're back live. Another hour and a half session. We're reinforcing the foundation and start tackling those previously avoided EKG concepts. More live interpretation practice with me, more nuance. Again, we're putting EKGs up on the screen. You're going to be interpreting them. Then I'm walking through them step by step. Okay. So the concepts that confuse people, that's not going to be you anymore. I'm not going to allow that to be confusing. Like I said, I was ordering stress tests on normal EKGs. So I'm not going to let you be me back in the day. Not at all. Then we wrap it up in week 6, where we just make this thing automatic and consolidated. So you're going to be able to revisit our live sessions because we have a portal where we will record the live session so you can revisit that at any point. You'll reinforce the system until it's in the background of your brain in a way that it does for the clinicians that you respect the most. So by the end of this, we don't scan hoping something jumps out at us. You're going to move through this in a systematic way. I always say I want your eyes bouncing because you have the systematic approach, okay? You're not deferring to the computer. We don't do that anymore. The computer is a second opinion, okay? It's not the first, you're not turning to the computer. It's, oh, it just happens to be there, okay? It is not a replacement for your clinical judgment. I do not want you hesitating. You know what you're looking at, you know why you're looking at it, and you're not waiting for someone else to confirm it, okay? So that is the outline of a whole 6-week program that I am super pumped for you guys to check out. So before I share the investment with you, I do want to talk about one other cost, okay? One other cost. Now, this is a cost that nobody really likes to list or talk about, but in every shift you walk into this system, every shift you walk into without a system, you are working inside that gap, okay? That 42% gap, the one where the machine is your primary defense and your gut is your backup, which we know the sixth sense, the nurse gut is real, right? And neither one is fully, you're not able to really fully trust that, okay? And that's not a comfortable way to be. That's why I started this whole thing, because I was uncomfortable. I was like, I was having palpitations every shift. I'm like, this is not a normal way to be, right? And it's truly not safe either, okay? So you can keep doing what you're doing. You know, you can wait. You can take another boring EKG course, you know, and force the memorization, force it, kind of hoping that it gets easier. But here is what I know from training thousands of clinicians over the last 5 years. It does not get easier with time. It gets more entrenched. The avoidance becomes habit, and the hesitation will become your identity. And one day you're going to realize that you've been a nurse for over a decade, EKGs still make you freeze, and now the gap feels too big to close. The nurses who want to avoid that outcome, the ones who actually close the gap, are the ones who make a decision, not someday, right now. So Normally, the full price of my EKG 100 experience is $19.97. However, shout out to us, Happy Nurses Week. Happy Nurses Week. For the next 24 hours, you can enroll for my special early bird pricing. Okay. So we have two specials that we're running right now. The first one is if you want to pay for the program in full, you can use coupon code early level up. You will get instantly $500 off, and the whole shebang will be $14.97. Now, we do offer a payment plan as well. The payment plan will be paid over a 4-week period. You will get $130 off each week. The total price of the payment plan comes out to be $15.88, but that discount is already applied at checkout. So you get to shift from the nurse who hopes the computer is right to the nurse who trusts themselves. The nurse who walks differently, speaks up sooner, catches what others miss, and you can stop carrying that low grade, or for some of it was high grade, anxiety, some of us, for years and years and years. So the question isn't really, is it worth it? It's whether you're willing to keep paying that other price, right? The one that shows up every shift, costs you nothing in dollars, and takes something from you every single time. So I will briefly show you guys how to sign up. And by the way, because we have CEUs attached, please use your CE money. Some of us, maybe present company, used to wait until the last day of the year to use all their CE money. Don't be like me. Don't do that. So, but if you go to drdmp.com/earlybird100, we'll go ahead and pop that in. This is the page with the EKG 100 experience. You see everything included, the things that I highlighted earlier. Like I said, the normal price here is at $19.97. If you go ahead, you will have to fill out this information here, of course, in payment, but let me show you the one-time payment. If you just type in the code early level up, and then hit redeem, you'll note the $500 is taken off instantly, and you have the early bird special. Okay. And then for those that are interested in the payment plan option, you would just simply, where it has pay once, you just click this button below, and then you get the 4 payments, weekly payments of $397, which again, it comes out to $15.88, but it would come out weekly for you. Okay. So that's kind of how you sign up. Super quick and easy. Once you sign up, you're going to get an email from us. Well, you're going to get 2 emails. One email is to verify your account so that you can instantly get access to those courses where you have lifetime access to. And then the second email is welcoming you to the EKG 100 experience and setting you up with the syllabus and what to expect and how we communicate and our first session and all of our Zoom links and all that sort of thing. Okay. So that is how you sign up for the EKG 100 experience. Before I go to questions and we're kind of nearing our end here, I do want to share some nurses and nurse practitioners who were sitting exactly where you are now, second guessing themselves, deferring, hoping. And I want you to watch what they say, but more importantly, watch how they say it. I want you to listen for the moments in which their stories, where the freeze stopped, where their confidence started, where that gap was finally closing for them. That's what happens when you have a system that takes the guesswork out. So I'm going to play this short 4-minute testimonial video, and I'm going to come back and finish up with you guys and answer any questions. So we'll go ahead and let it play.
I didn't have a really good understanding of EKGs, and although I've worked in different areas, even despite buying different books and going to different classes, I never really had a solid foundation for EKGs.
I had been researching, looking for a course, a program. I bought books and materials, but nothing actually seemed to help.
Before learning with Dr. G, I was able to kind of get by with my EKG interpretation.
I was completely lost the ability to read EKGs or lack confidence of my ability to do or read EKGs since I don't do this on a regular basis.
But the concept of EKG has been kind of like a mystery.
I really honestly relied a lot on my peers to help with reassurance, and my confidence was pretty low with interpretation.
Before the class with Dr. G, I was going to my collaborator directly for EKG assistance, even for the basics.
I didn't have any confidence at all looking at EKG. Really, whatever the computer said was going to be probably what it was.
So before I purchased the course, I was not very confident. Couldn't really tell you a lot about EKGs, even though I'd been around them my entire career.
Before I did the Dr. Z EKG course, I was thinking EKG is the most worst confused.
I went to one of her sample-free lectures, and I saw the way that she taught. And from seeing that it was going to work for me, that's how I chose Dr. G to teach me about EKGs.
She's a nurse practitioner, and a great educator, comes from a family of educators, and you could tell her approach was definitely rooted in those.
But I did do the introductory course, and I learned several things just in that. And
what really drew me to her was when I reached out to her about a class that I wanted to take that I didn't see. She was very prompt in returning my message and reaching out to me, letting me know when the next scheduled lecture would be, in addition to the actual calendar, and how personable she was even on that level.
So now I'm able to see EKG and understand if it's a normal or abnormal, and if I need to do any further intervention for my patients, especially for the preoperative clearance, because I work in a primary care provider.
After the class with Dr. G, I'm more confident. I'm able to go to my collaborator with what I see and able to dive more into the plan and goals for the patient instead of spending as much time of reading the EKG.
It was great being able to give a case study of some of my patients and get that feedback immediately.
I really feel like my confidence has soared through the roof. I know what I'm looking at. I'm much more accurate with the interpretations now than I was before. And I have improved outcomes and recommendations for my patients because of it.
One of the things I enjoyed is her overall knowledge and her ability to break down the EKG and develop it in simple terms, so that way I can understand and comprehend how to properly interpret EKG.
Dr. G, the NP, is amazing as an individual as well as a brand. She is passionate about patient care and teaching her fellow nursing colleagues.
Utilizing your services was to gain immense confidence completing and reading EKGs. And I did achieve that through your course.
I would tell all my friends and my colleagues and even my nurse practitioner student, please attend Dr. Z EKG video or EKG.
I say go get it, especially if you're lost or you just need a refresher.
And of course, she's your go-to for all EKG related situation and needs.
I always say I literally have the best clients in the world. It's truly been an honor and a privilege to serve my community and whatnot for 5 years, which is like crazy to me. But I'm honored and blessed, and so we're having real outcomes and we're having real practice changing. So here's where we are, guys, and I'm going to get to the chat here in a second. So you came here tonight knowing something just was not working, right? The anxiety, the hesitation, the quiet dependence on the machine, that's wrong nearly half of the time. So tonight you saw a glimpse of what it looks like on the other side, with one step, with one starting point, and a new approach, right? Teaching through analogies, teaching through storytelling, teaching through cartoons, the things that are fun, that stick and are engaging and interactive for you. So the rest of the system is waiting on you. Like I said, the coupon expires in 24 hours, and the link, I will drop the link in the chat as well. But one thing I want to say one more thing about is, the nurses who don't act on this tonight won't do it because, it's a pricing issue, or because they don't care, or because they, think it wouldn't help. They don't do it because change is uncomfortable. And I acknowledge that change is uncomfortable. It was scary for me to even do this 5 years ago. Here we are 5 years later. I still have my platform and we're making practice changing things for people. But staying where you are is not safe. That's just what you need to know. Staying where you are is not safe. So are you the nurse who knew then are you the nurse who wants to change, or are you going to be the nurse who, kind of stays in that gap, right? So, like I said, the link is open. We start the boot camp on Thursday, May 28th at 7 p.m. Central Time. I am super pumped. So y'all get in there. I'm ready to get to it. It's going to be fun. For those of you who have signed up, welcome, welcome, welcome. Like I said, you're going to get an email. Well, like I said, 2 emails. If you do not see 2 emails, make sure you check your junk or your promo, because sometimes that does happen. And also, I will drop not only the link, but I also drop my email address in the chat for you guys. So let me go ahead and do that. Cannot type tonight, but we'll work it out. So that's the link. And then here's my email address. It's contact@drgdmp.com. Like I said, that's my email address. That is not a VA or anything like that. So Rhonda, like I said, thank you so much for coming. We did cover that step 1. I would be elated to have you in the rest of the program so you can get the rest of my 9-step interactive approach. And we talk about some things, some EKG don'ts as well, kind of mentioned in the experience. So get while the getting's good. You can look at my Google reviews. You heard my testimonials. It's just been an honor and a privilege to serve my community. So I'm going to keep on keeping on and keep doing what we do. So like I said, guys, thank you so much for joining tonight. We will have this recorded session up on the replay page. And so my team will be emailing about replays if you want to review the session as well. On the replay, we also will have another, we will be offering this, but the discount won't be as good. I can tell you the discount won't be as good as it will be for the 24 hours. So like I said, thank you guys for attending. Pumped. I cannot wait to have you in the EKG 100 experience. It is going to be a time. Otherwise, I hope you guys have a blessed night. Happy Nurses Week, and I will see you on Thursday, May 28th, 7 p.m. sharp for week 1 of the EKG 100 experience. Okay. Thank you guys so much. Y'all have a fabulous night, and I will see you in session. All right. You guys take care. Have a good one. Bye-bye.